الرحيم. يعطيك العافية دكتور محمد. أنا الطالبة حنين باسم البسيوني. I will explain 5 diseases related to the arterial disorders. The first disease is Wegener's granulomatosis. The granulomatosis with polyangiitis, GPA, known as Wegener's, is rare, chronic, and multisystem autoimmune disease of uncertain cause. It result of inflammations within the tissue called the granulomatous inflammations and blood vessels inflammations called vasculitis, which damage organ systems. And the Wegener's characterized by granulomata of the respiratory tract and systemic necrotizing vasculitis, and the anti-neutrophil cytoplasmic antibodies with specificity for proteinase 3 are defining features of this disease. The conditions can lead to inflamed, narrowed blood vessels and harmful inflammatory tissue masses called granulomas. The GPA primarily affect the upper respiratory tract like sinuses, nose, trachea, lungs, kidney, and other organs in the body can be affected. The symptoms of the GPA and their severity vary among patients. General signs of this disease may include loss of appetite, weight loss, fever, fatigue, and there's some pictures for patients suffer of Wegener's. Besides affecting nose, sinus, throat, lungs, and kidney, granulomatosis with polyangiitis can affect the skin, eyes, ears, heart, and other organs. And the complications of this disease include hearing loss, skin scarring, kidney damage. The treatment of GPA depends on the severity of the disease. The severe disease is treated with the combinations of immunosuppressive medication such as rituximab or cyclophosphamide and high-dose corticosteroid to control the symptoms of the disease, and azathioprine, methotrexate to keep the disease under control, and there's plasma exchange is also used in several cases with damage to the lungs, kidney, or intestine. The second disease is Polyarteritis Nodosa. Is rare autoimmune disease featuring spontaneous inflammations of the artery called arteritis or vasculitis. Polyarteritis Nodosa is characterized by segmental transmural necrotizing inflammations of muscular arteries. Because arteries are involved, the disease can affect any organ of the body. The most common areas of involvement including the muscles, joints, intestine, nerves, kidney, and the skin. Polyarteritis nodosa is most common in middle-aged people. It is caused in unknown, but it has been reported after hepatitis B infection. This disease causes symptoms and signs that are result of injury to the blood vessels. Therefore, the symptoms and signs depend on which vessels are affected and to what degree this can lead to organ damage or injury. For example, if blood vessels supplying the nerves or muscles are affected, the nerves or muscles can be damaged, and if the blood vessels to the kidney are affected, kidney damage with the blood in the urine can result. And symptoms and signs can include fatigue, weight loss, high blood pressures, muscle pain, myalgia, joint pain, arthralgia, testicular pain, nerve damage, and abdominal pain. Polyarteritis is serious illness that can be fatal. Treatment of this disease is directed toward decreasing the inflammations of arteries by suppressing the immune system. Medication used to treat polyarteritis nodosa include high-dose intravenous and oral cortisone medication. The third disease is Kawasaki disease, or called mucocutaneous lymph node syndrome. It is illness that causes inflammation in arteries, veins, capillary. It also affects lymph nodes and causes symptoms in nose, mouth, and throat. It is common cause of the heart disease in the children. Kawasaki is acute febrile illness and systemic vasculitis of unknown etiology that predominantly afflicts young children. cause coronary artery aneurysms, and can result in long-term cardiovascular sequelae. The cause of Kawasaki disease are not well understood. The disorder is generally a result of abnormal immune system's activations, but the triggers of this abnormal response are unknown because cases of the disorder tend to cluster geographically and by season. Kawasaki is most common in children, particularly those of Asian descent. About 75% of Kawasaki disease cases are children under the age of 5. The researchers don't believe that can inherit the disease, but the risk of factors tend to increase within families. Some children with Kawasaki disease suffers coronary arteries lesion. The symptoms of this disease: fever, large lymph nodes, rash, sore throat, diarrhea, and have complications like coronary artery aneurysms. Treatment of Kawasaki include intravenous gamma globulin and high-dose aspirins. Medicines help reduce the swelling and inflammations in the blood vessels. Intravenous gamma globulins can decrease but not eliminate. The fourth disease is Guyon's arteritis, also called temporal arteritis. Is an inflammatory disease of large blood vessels. The cause is unknown, and it is autoimmune disease. The mechanisms involved inflammations of the small blood vessels that occur within the walls of the large arteries. This mainly affects artery around the head and neck. The chest may also be affected. Guyon's arteritis is primarily a disease of cell-mediated immunity which arises as a maladaptive response to endothelial injury. There are several factors can increase risk of developing Guyon's arteritis, including age, sex, race, and geographic regions, polymyalgia rheumatica, and family history. In details, the age. Guyon's arteritis affects adults only and rarely under 50. In sex, women are about 2 times more likely to develop the conditions than men. And the race and geographic region, Guyon's arteritis is most common among white people in Northern European population. Polymyalgia rheumatica increased risk of developing Guyon's arteritis. Symptoms of Guyon's arteritis: headache, pain over the temples, flu-like symptoms, double vision, difficulty opening the mouth. And there's complications like blindness, aortic dissections, aortic aneurysms, polymyalgia rheumatica. And the treatment of it: steroid or biphosphonate, protein pumps inhibitor. The fifth disease and the final is Takayasu arteritis. Is a rare type of the vasculitis, is a group of disorder that cause blood vessels inflammation. In Takayasu arteritis, the inflammations damage the aorta, the large artery that carries blood from heart to the rest of the body and its many branches. The pathogenesis of Takayasu arteritis mostly involved cell-mediated immunity. With Takayasu arteritis, the aorta and other major arteritis, including those leading to head and kidney, become inflamed over time. The inflammations cause change in these arteries, including thickening, narrowing, and scarring. No one knows exactly what caused the initial inflammations in Takayasu arteritis. The condition is likely autoimmune disease in which immune system attack arteries by mistake. The disease may be triggered by a virus or other infection. Risk factors of Takayasu arteritis primarily affects girls and women younger than 40. The disorder occurs worldwide but is mostly common in Asia. Sometimes the condition runs in families. Symptoms of Takayasu disease include painful, cool or blanched extremities, dizziness, head ache, chest pain, and abdominal pain. And complications of Takayasu: hardening and narrowing of the blood vessels, which can cause reduced blood flow to organ and tissue. High blood pressures, usually as a result of decreased blood flow to kidney, and inflammations of the heart, which may affect the heart muscles or the heart valves. Heart failures due to high blood pressures, inflammations of the heart or aortic regurgitations. This is conditions in which a faulty aortic valves allow blood to leak back into a heart. And there's stroke, which occur as a result of reduced or blocked blood flow in the arteries leading to the brain. Aneurysm in the aorta occur when the walls of the blood vessels weaken and stretch out, forming a plug that has the potential to rupture. Heart attack, which occur as a result of reduced blood flow to the heart. Treatment of Takayasu disease: methotrexate, azathioprine, and cyclophosphamide. And in the end, I hope you like the presentations, and goodbye.